Hello guys, welcome back to Medico Days. So this is the video with the compilation of all the 200 questions which came in Neetpg 2025. Guys, I have tried to keep this video with all the correct answers and without any repeat questions. But if at all there is something like that, please do make it into my notice by mentioning it in the comment section, or you can personal message me, or you can put it in my Telegram group. And so after that I will edit all these questions and then make a final one without any repeats. As far as possible, I have tried to keep this video also without any repeats and without any wrong answers, but if at all there has become any fault in this video, then please make it into my notice. Now quickly moving on to the first question. IBQ of a parasitic, answer is Enterobius vermicularis. Next, pedigree with mother giving disease to all her children but father doesn't give to his children, answer is Kernsayer. Next, thyroid carcinoma with TTF, synaptophysin positive and amyloid positive, answer is medullary. Next, a patient with TB-like symptoms after travel history with microscopic image given, answer is histoplasmosis. Next is an image of a granuloma with giant cell containing stellate inclusion, answer is sarcoidosis. Next, a very tall man had problems with vision. When he went to ophthalmologist, he was diagnosed with ectopia lentis. Gene affected is fibrillin. Next, anti-SCL70, most commonly associated with, answer ILD. Next, group A streptococcus is the main reason for bacterial pharyngitis in school-going children. Which of the following is mainly responsible for attachment of fibronectin to epithelial lining of the pharynx? Answer is lipotecoic acid. Next, investigation of choice for CLL, answer is flow cytometry. Next, follicular lymphoma pathology, answer is T1418. Next is an image-based question of the faggot cell, answer is AML-M3, and the mutation is T1517. Next, caspases are used in, answer pyroptosis and apoptosis. Next, image of sinus with the swelling was given, answer is septate hyphae with 4 to 5 micron width. Next, dermatitis herpetiformis with history of gluten sensitivity, celiac disease. Next, identify the mosquito from the image and larva having no siphon tube, answer is Anopheles. Next is a seminoma histopathology image, answer lymphocyte infiltration. Next, hexosaminidase deficiency is seen in, answer GM2 accumulation. Next question, a man contracting diarrhea after intake of milk products, organism was gram negative and history of a son being a farmer, answer is Campylobacter jejuni. Next, retraction balls in biopsy following RTA, answer is diffuse axonal injury. Next question, a sewage worker with jaundice and hemorrhage, answer is Weil's disease. Next question, painful vesicular ulcer around the mouth, multinucleated giant cells and intranuclear inclusion, diagnosis is herpes. Next one, drug for prophylaxis of meningitis, answer is rifampicin. Next question, history of anemia and MCHC is increased and history of semen father also, answer hereditary spherocytosis. Next, Antony A and Antony B bodies are seen in, answer schwann. Next, positive bifringent rhomboid shaped crystals seen in, answer pseudogout. Next is an image based question and answer is meningioma. Next, gross image of an ovarian tumor was given, answer is serous cystadenoma. Next, a brain image with hemorrhage and the organism is most commonly Neisseria meningitidis or the meningococcus. Next, McFadden reaction is to identify, answer Bacillus anthracis. Next, benralizumab is related to, answer interleukin 5. Next, filamentous gram positive Zn staining positive, answer is nocardia. Next is an image based question of the translational epithelium, answer is ureter. Next, on histopath, fried egg appearance with central branching smooth muscle, image based question, answer is seminoma. Next, postmenopausal bleeding history with an image, answer is adenomyosis. Next, septate with dichotomous branching, answer is aspergillus flavum. Next, OBG manure image was given, answer is Lawson's manure. Next, hemosiderin laden macrophages is seen in, answer right heart failure. Next question is an IBQ and answer is meralgia paresthetica. Next is an image of an anal fistula, answer is intersphincteric. Next, breast image and the staging was asked, it was a PUD orange image and the answer here is T4D. Next, destruction of salivary glands and lacrimal glands by lymphocytes, seen in, answers Sjogren's. Next, 10 to 19 years VIPS program dose, so 100 mg iron and 400 microgram folic acid is the one which is provided in adolescents. VIPS was actually for adolescents, but in this question 10 to 19 years VIPS program, it is to be 10 to 19 years. But if at all if there is anything mentioned about pregnant lady, then the answer should be 60 mg iron plus 400 microgram folic acid, because that is the one which is provided to pregnant ladies, but VIPS doesn't include that. The pregnant ladies are not included under VIPS. Next, rhinoderma image, it is due to deficiency of ocular manifestation vitamin A. Corneal gadeta, answer is Fuchs dystrophy. Next, image throttling. Next, diazepam febrile seizures. Next, palpable gallbladder fever and pain, answer is CA pancreas. Next question about hyperpigmentation is due to, answer ACTH. Next, nocardia paraffin bead technique is the answer. Next question on acute stress disorder. was there. And next, Holman-Miller sign is seen in, answer angiofibroma. Next, which vitamin deficiency will occur if a limb is resected? Answer vitamin B12. Next, a 25-year-old sustained femur fracture. 3 days later, he developed dyspnea and petechial hemorrhages. Answer is fat embolism. Next, pegloticase mechanism of action is it converts uric acid to allantoin. Next, in a surgery of duodenum, accidentally a vessel is injured and heavy bleeding occurs. It is because of IVC injury. Next, anesthetic agent which is related to malignant hypothermia. What is the treatment? Answer is dantrolene. Next, IBQ. It was the surgeon's nod. Next, amiodarone mechanism of action, it blocks the potassium current. Next, Garlicky order is seen in, answer arsenic poisoning. Next, loading dose of Pritchard's regimen 4 mg IM MgSO4 plus 10 mg IV. Next, Rene was positive on right side and Weber's was lateralized to left, and Rene was negative on the left side. So the answer here should be left conductive hearing loss. Next question, tics tardive dyskinesia. Answer is valbenazine. Next, Zasco phenomenon, tendon reflex after death. Next, neck x-ray, IBQ. Answer is pyriform sinus. Next, lupus vulgaris is diagnosed by, answer PCR. Strasbourg classification for bile duct injury, image based question. Answer is type A. Next, a patient with HIV and TB management. Answer is anti-tubercular therapy for 2 weeks and followed by ART. Next, anal carcinoma, lymph node related is superficial inguinal. Next, Nalgonda technique, it includes alum and lime, bag A and D. Next, achalasia cardia, investigation of choice is manometry. Next, a person with hyponatremia, hyperkalemia, hyperpigmentation and salt craving. Answer is Addison's disease. Next is an image based question of a lady with swelling near the right eye. Answer is dermoid cyst. Next, mediolateral episiotomy treatment. First is mucosa, muscle and then skin. Next, isolated elevation of ALP and change in head circumference. Answer is Paget's disease. Next, image of a child with intestines and chest cage, X-ray, and the answer is congenital diaphragmatic hernia. Next, de facto, it is present during remuneration, and question about generation time was also asked. Next, pre and intra-op drug for pheochromocytoma. Answer is phenoxybenzamin. Next is an image-based question. Answer is Perthes disease. Next one, middle finger necrotic lesion with redness on the dorsal aspect of the hand. Answer is tenosynovitis. Next is about to arrange in the correct sequence. Answer is randomization, manipulation, follow-up and assessment. Next is an image-based question. Answer keratoconus. Next question, nerve supply to mylohyoid. Answer is nerve to mylohyoid, which is a branch of inferior alveolar nerve and the facial nerve. Next, which amino acid will not be synthesized due to vitamin B12 deficiency in a patient with a history of ileectomy with elevated homocysteine levels, increased methyl malonyl CoA and peripheral neuropathy? Answer is methionine. Next, anti-Mullerian hormone level is decreased in, answer premature ovarian failure. Next, a frameshift mutation occurs due to insertion of a new nucleotide at the 4th position of mRNA sequence with 900 nucleotides. Most likely outcome of this mutation is complete change in protein production. Next is an image of a lower limb swelling. Answer is lymphatic blockage. Next, Liar's sign is seen in, answer carotid body tumor. Next question, carpopedal spasm is a complication of, answer thyroid surgery. Next, a patient is on insulin and on tab metformin. HbA1c is 8.3. Heart failure is present in the patient. Next medicine is tab empagliflozin, which is an SGLT2 inhibitor. Next is an image-based question. Answer lower mandibular nerve. Next, which nerve does not contain GSC fibers? Answer vagus. Next, hyponatremia patient develops stroke. Next step is MRI. Next, root value for lateral cutaneous nerve. Answer is L2, L3. Acromegaly confirmatory test was the next question. Answer is IG1 failure of suppression of GH. Next, a patient with CKD and anemia. Drug to be given is erythropoietin or darbepoetin. Next, number of urban PHC. It was a calculation based question. Answer is 42. Next, a child with visual disturbances. Supracellular mass is present. Wet keratin on HPE. Answer is craniopharyngioma. Next question, lab technique used to compare and quantify CD markers. Answer is flow cytometry. Next question, antimitochondrial antibody positive in. Answer primary biliary cirrhosis. Next question, uterine prolapse management. Answer push-up and retrograde filling of the bladder. Next one, shoulder dystocia. Sequence of management is, answer Macroberts, Rubin, Gaskin and Zavanelli maneuver. Next, amniotic band syndrome. Answer is Sheehan syndrome. Next, ECV and the baby develops fetal distress. Answer is rotate the baby to the original position and later do C-section. Next was a question on control code traction. Next question was on prevention of thrombosis in female with BMI more than 35. Answer is low molecular weight heparin. Next, uterine prolapse. The ligament related is, answer cardinal ligament, which is also known as the McEnroe or the transverse ligament. Next question, in day 21 to 25 of menstrual cycle. Answer is LH and FSH are decreased. Next, a patient with white dandruff-like deposit on the anterior lens surface. Answer is pseudo-exfoliation syndrome. Next, binocular single vision consists of SMP and fusion. Next, true about orbital cellulitis. Answer, ethmoidal sinusitis is the most common etiology. Next, most common cause of squamous cell carcinoma in the base of the tongue. Answer is HPV. Next, persistent oral lesions in 6 months. History of GERD on spicy food. Which drug? Answer is beta blockers. Next, a 70-year-old man with chronic back pain which worsens during morning and associated anterior uveitis is present. Investigation of choice is MRI. Next one, man with shoulder pain during extension. On examination, a tear in the long head of triceps is present. It originates from infraglenoid tubercle. Next question, a 25-year-old with fracture of the left tibia, severe pain and it worsens on dorsiflexion. Peripheral pulses are present, sensations are lost. Management is immediate fasciotomy. Next, knee replacement surgery was done for a patient. After 7 days, he presents with dyspnea and tachycardia. Investigation of choices CTPA, that is CT pulmonary angiography. Next, diabetic patient with COVID-19 dies in the hospital. Which type of surveillance? Answer is passive. Next, a study compares mean hemoglobin of 2 independent groups. Statistical test is unpaired t-test. Next, a 3-year-old with difficulty in walking and bowing legs, underweight and less sun exposure. Government scheme related is ICDS. Next, prevention of coronary artery disease. Recommended dietary cholesterol intake per day is 100 mg per 1000 kilocalorie. Next, measure degree of objective and target achievement in health program is by evaluation. And next one, community intervention to control sepsis. 20 PHCs were given standard care. 20 PHCs were given community-based intervention. Study design is cluster RCT. Next, in the VQ graph, which points show pulmonary embolism? It was an image-based question. Answer was point D. Next, a man when trekking to high altitude. Most common acid-base abnormality. Answer is respiratory alkalosis. Next, Katori method for a 7-month-old child. Answer 1 Katori for 4 times a day. Next, a woman with atonic PPH after vaginal delivery not responding to initial management. Next step is balloon tamponade. Next, a woman with fetal bradycardia and maternal tachycardia. Most appropriate immediate management is C-section. Next, how many vein and artery in a normal umbilical cord? Answer is 1 vein and 2 artery. Next, a woman with breast tenderness present. Linea nigra, bluish discoloration of cervix. Answer is probable pregnancy. Next, penetrating injury and unstable patient. Next step is explorative laparotomy. Next, a patient on medication came with renal stones. This is because of the decreased calcium excretion. Next, a 2-year-old came with choking after peanut ingestion. Management is chest compression. Next, POSCO is related to answer under age of 18. Next, father was ill. Doctor said he can't be recovered by further management, but daughter wants to keep in ICU. Answer, keep the patient in ICU and intubate. Next, immature teratoma is positive for answer CA125. Next, breast cancer screening, early detection but increased mortality rate has not been changed. Type of biases, lead time bias. Next, footballer with foot eversion. It is because of injury to anterior talofibular ligament injury. Next, Hurler syndrome deals with answer dermatan and keratan. Next, exclusion criteria for BPAM regimen. Answer miliary TB. Next is the calculation based question. What is the value of X? Answer -2. Next, HIV load more than 1000 to prevent transmission to newborn. What is to be done? Answer nevirapine plus zidovudine for 12 weeks. Next, PDA is because of defect in which arch? Answer 6th. Next, a person eating jowar rice develops osteoporosis. Answer, fluoride supplementation should be given. Next, wood clamp image of a 10-year-old child shows intense bright blue-white areas. Diagnosis is nevus depigmentis. Next, head station is -1. Cervical dilation is 8 cm. Management is LSCS. Next, lower esophageal sphincter and gastric emptying is promoted by answer metoclopramide. Next, factor 9 deficiency gets better after giving vitamin K in which of the following condition? Answer, bile duct obstruction. Next is an image-based question. Answer, spondylolisthesis. Next, a child with fracture on leg with trivial trauma and splaying of metaphysis. Etiology is vitamin D deficiency. Next, image-based question with central stellate scar. Answer, focal nodular hyperplasia. Next, a woman with migraine was started on sumatriptan. She has family history of coronary artery disease. Appropriate drug for migraine is prophylaxis is propranolol. Next, component C5 to C9 is related to Neisseria. Next, a patient presents with xanthoma, increased cholesterol, LDL is high, triglyceride levels was normal. There is history of death of father due to MI. Answer is hyperlipoproteinemia 2E. Next, a patient says that when he sits down, he hears flapping sounds of the bird's wings. He believes it is a sign of God to him to move in a specific direction. Which psychopathology does it present? Answer, delusional perception. Next, a 35-year-old is found wandering in another city by a social worker. He appears confused about his identity. He cannot recall how he reached there. There are no signs of intoxication or head injury, and he is unable to provide personal information, and he seems to have sudden unexpected travel away from home. Diagnosis is dissociative fugue. Next, Mr. K is rigid, overly focused on rules and order and perfectionist. He submits his work late as he focuses on perfection. Most likely disorder is OCPD. Next question. During surgery, muscle relaxant was administered to patient, which led to facial flushing and hypotension. It is because of atracurium. Next, MCU is used for. So it was an image-based question. Answer is VUD. Next, following a building collapse, a patient with airway obstruction undergoes a procedure in the image. True about it is it will be followed by tracheostomy. Next question, identify the type of the suture material in the image. So PDS was given in the image. Answer is monofilament. Next question, true about varicose veins. Answer is it can progress to eczema and ulceration. Next question was question with normal thyroid uptake, and the answer is iodine deficiency. Next question, the blood sugar level was raised 2 to 3 times and then it stays elevated for a constant period of time. Correct about it is answer first it rises, then sustained increased level. Next, based on VVM, which vials will be used? Answer 1 and 2. Next, a 30-year-old man with bronchial asthma is currently using salbutamol and ipratropium meteor dose inhalers as needed. She reports frequent nocturnal symptoms including wheezing and breathlessness that wake her up several times in a week. Most appropriate next step is add LABA and inhale corticosteroids. Next, a patient with DKA not a part of initial management is IV 3% NaCl. Next, best PCR method to diagnose organism causing meningitis? Answer multiplex PCR. Next, a 46-year-old woman with 16 mm endometrial thickening on transvaginal sonography. Next step is endometrial biopsy. Next, a 65-year-old postmenopausal woman presents with bloodstained vaginal discharge. BP is 170 by 100. Next step is pelvic examination with pap smear and transvaginal sonography. Next, a pregnant lady presents in first trimester with history of toxoplasmosis 5 years back. IgG is positive. What is the advice to be given? Answer safe to continue the pregnancy. Next, prolactin will cause amenorrhea because of decreased GnRH. Next question, a 23-year-old woman comes to OPD. She does not remember her LMP. Best method to calculate her period of gestation is crown round length. Next, an NST is being done for a patient who presented with decreased fetal movements. NST shows 1 acceleration in 2 minutes. Next best step is answer continue NST till 40 minutes. Next question, a patient with markedly high plasma phenylalanine levels and low thyrosin levels. Phenylalanine hydroxylase enzyme assay is normal. Which deficiency is most likely responsible for this presentation? Answer biopterin. Next question, a 36-year-old woman with symmetrical small joint arthritis is positive for anti-CCP antibodies. Which histological finding is most characteristic? Answer Panus formation. Next, a patient presents with sudden onset weakness and aphasia for 2 hours. Pulse is irregularly irregular. CT head is normal. Immediate next step is start TPA. Next, a 45-year-old female with 6-month history of PND, palpitations and breathlessness, irregularly irregular pulses seen, tenter, hepatomegaly, heaving apex, mid-diastolic murmur at the apex. Patient also has history of acute rheumatic fever in the past. What is false? Answer pre-systolic accentuation of MDM is a hallmark feature. Next, a 60-year-old patient with AF and aphasia and weakness. Next step is TEE. Next, sodium 130, chloride 84 and bicarb 16. Calculate the anion gap. Answer is 30. Next, a 60-year-old man with long-standing COPD presents with dyspnea. pH is 7.32, PaCO2 is 60, bicarb is 30. Primary acid-base disorder is chronic respiratory acidosis. Next, a 48-year-old man with ARDS due to COVID-19 is on mechanical ventilation. Which ventilated strategy is most appropriate? Answer high PEEP with low tidal volume. Next question, a 34-year-old female presents with right upper limb weakness over 3 months. There is marked atrophy of right deltoid and biceps fasciculations and hypertonia present. Deep tendon reflexes are absent in the right upper limb with intact sensation. Site of lesion is anterior horn cells in the cervical spinal cord. Next, a 55-year-old man on long-term hydrochlorothiazide for hypertension presents with progressive symmetrical distal paresthesia, weakness and signs of heart failure. Examination reveals decreased vibrations and position sense in the feet. Nutrient deficiency is vitamin B1. Next, a hospitalized patient was administered IVF, after which he developed hyperchloremic metabolic acidosis. Which fluid is responsible for this? Answer normal saline. Next, a 38-year-old woman presents with salt craving, generalized hyperpigmentation, hyperkalemia and metabolic acidosis. Diagnosis is Addison's disease. Next is a chest x-ray. This is a confusing question. I need help from you guys. So answer here could be lung collapse, lung consolidation or lung abscess depending on the image given. Next, atrial fibrillation, initial management is verapamil. Next, in submandibular gland resection, which structure can be affected? Answer facial artery. Next, which nerve doesn't pass through the market foramen? Answer hypoglossal. Next, 60-year-old patient presents with epistaxis. He is a non-hypertensive. Packing was unsuccessful. Which artery is to be ablated? Answer sphenopalatine artery. Next, a patient presents with displaced nasal bone fracture after an RTA. Which instrument is used for nasal bone reduction? Answer Waldstrom forceps. Next, a 25-year-old presents with ear discharge episodes and decreased hearing. Best treatment is myringoplasty. Next was a question on sarcomere, and next again there was a question of total laryngectomy. Then there was a question about leak of toxic fumes from a factory. Next step by civilians who have been informed about the leak is close all the windows and cracks in the home. Next question, clinical scenario of xeroderma pigmentosa was given and which DNA repair pathway is affected was asked. Answer nucleotide excision repair. Next, a 16-year-old girl gave consent for sexual intercourse. answer, girl's consent is not valid as she is less than 18 years old. Next question, a man assaulted his colleague and upon being caught claimed that he heard his boss telling him that his colleague is going to kill him and so he attacked in self-defense. Next step, refer him to a psychiatrist for comprehensive evaluation of the mental state. Then next question, the last question, a man survived without food for 5 days. Primary energy source for brain during starvation is ketosis. So that's it, guys. If there is any queries regarding the questions, please do mention in the comment box, or you can put it in my Telegram group, or you can personal message me in Telegram. So we'll be checking out on that and making the final video after making everything correct and perfect. So that's it, guys. Till I come back with my new video, stay tuned. Till then, bye.